Staff shortages at the Mahikeng Provincial Hospital in the northwest has caused delays in critical surgical procedures for patients. Some patients are left unattended for over a month, while others are returned after being informed about the cancellation of their appointments due to a shortage of available nurses for the theatre. The Provincial Health Department says it's finalising the process to recruit nurses to stabilise the operating theatre by the 30th of June this year. Newzroom Afrika's Refiloe Seboko is joining us now from Mahikeng Provincial Hospital. Does it seem, Refiloe, that the hospital now has its house in order, given that they have been able to give dates and are telling us of what is going to happen over the next few weeks?
It sure does sound like the hospital now has their house in order, Vuyo, considering that they have made that announcement that they are finalizing the process of appointing nurses because the shortage of staff, but also the backlog in terms of surgeries has been cited, or they blamed on the some nurses resigning and going for greener pastures, but also what the spokesperson of the department had indicated in his response is that there are some staff members that have gone on sick leave, among others. But this is an issue that we understand, according to the NOSA in the Northwest Province, saying that it's a long-standing issue that is of concern. They have raised these issues about shortage of staff members, and also that seems to be affecting patients now, whom some, we understand, they have been here in the hospital for over a month now. Some that comes and be admitted just as they will be expecting to go for those surgical procedures. They are then being told that there has been cancellations, or they need to go back home, and then they will be called back as soon as the nurses and theatres are available for those operations. But let's listen into Danosa in the Northwest Province with regards to what they think the problem is, considering that they have raised this issue before, and how they would like this matter to be addressed.
Ours is a concerning take in relation to what is happening to MPH, because these are issues that we have been consistently raising. And it is known, it's not a new thing, it is known that you will find a situation where there is a delayed performing of surgeries, there's a returning of patient when they must be performed surgeries, there's prioritization of surgeries to some patient. The critical issue here is a systemic error which comes from even at national level. You then realize that the budget over time for healthcare has been reduced, which then is going to impede on increased number of nurses, including the nurses specialists, because these cadres, they are leaving for private sector, for greener pastures, including going abroad.
And besides the Department of Health, Vuyo, indicating that there is, they're finalizing the process of appointing nurses, they've also indicated that there will be extension in terms of operating hours at the theatre, and also that, there will be some operations that will also be conducted over the weekend. Let's listen into a spokesperson of the Department of Health in the Northwest Province, Seboko, with regards to the arrangement that they have put in place.
The department is aware of the challenge of backlog at the operating theatres at the Mahikeng Provincial Hospital, and this is largely due to shortage of operating theatre trained nurses. We can, however, assure everyone that the department is working around the clock to address this challenge. For example, as we speak, the department is finalizing the process to recruit nurses to stabilize the operating theatre. And we have long started with this process, and that is why we are confident that the recruitment process will be finalized by the end of June this month. This will help us to increase theatre operating time as well as the number of operating theatres over the weekends. And once that is achieved, we believe that we'll be able to deal with the backlog.
And that is what the department has to say at this point, Vuyo, on how they're going to deal with the backlog. However, some of the patients that we've been able to speak to on the call, though they don't want to come on camera, or even when we're saying that we will, ensure that their identity is not revealed, they had, expressed their frustration, considering that some they have been here at the hospital for over a month now, that their operation has been done, and they have now been discharged. But they were just talking about the frustration that they had to endure as they were kept here at the hospital waiting for over a month for those critical surgical operation and procedures to happen, and they have not been happening. And now we understand, based on that responses that we are getting from the department, that they seem to be having their house in order with the extending operating hours until 7 o'clock, but also the theatre that will also be expected to operate also over the weekend.
Hopefully, they will indeed deliver on those provinces. Refiloe, Seboko with that update from the Mahikeng Provincial Hospital.